talking with Jack Silberman earlier about the importance of getting in shape and exercising properly, eating well. Dr. Sean Jones from Chattanooga Wellness also on the show this morning.
It's great to be here, Julie.
Great to see you because
I can see my breath.
It's a beautiful, crisp
It feels
fall
good,
morning.
though. I love it. I love it.
You tie in beautifully, I think, with this idea of taking care of yourself and
Absolutely.
wellness. That's the name of Chattanooga Wellness. Your focus this morning, though, is on neuropathy. If
That's
you
right.
are suffering with neuropathy because, I guess, you're not feeling well, you're probably limiting how much you're getting around and moving,
Well,
right?
you can't live life to your fullest anymore. And that's the thing that gets sad is people get to the point where they become bedridden. They start falling and they don't even want to get up and go to the restroom hardly. And that's really sad. So we have a 98% success rate with our program where people get better, you know. And
I
it's
want to stop you a
fascinating.
minute. So are you saying that one of the reasons that people who have really severe neuropathy don't get up and move a lot is because they're afraid they're going to fall?
Yeah, as neuropathy progresses, what happens is you get to the point where you start to lose your balance. And it's kind of like, in a way, like Parkinson's does. When people progress with Parkinson's, they start bending over farther and farther to lower their center of gravity. People with neuropathy either have a lot of pain or they just can't tell where their feet are. So if you can't tell where your feet are, you have to use your eyes to make up for proprioception.
Okay.
Proprioception is when you can touch your nose without your eyes open. You have to rely on your nerve receptors, the proprioceptors.
So what you do at Chattanooga Wellness is you've been a long time big believer in this K laser that you have.
Correct.
Why
Yeah.
does that work so well, and what does it do?
Well, what's unique about our program is we use a $30,000 laser called a K laser, or a class 4 cold laser. And the cold laser is 20 watts of power that super heals tissue. So all laser does 4 things. It decreases pain, it decreases swelling, it increases blood flow, and it super heals tissues. By that, what I mean is it makes your mitochondria of your cells, the whole cellular respiration, when laser hits it, it supercharges. And that's why my twin brother's nerve reconnected in 10 days instead of 5 months when he tore his hand up, because we ran that laser twice a day for 30 minutes through the cast, and it made the nerves grow much, much exponentially faster and
Okay,
heal.
you were telling me, because whenever I think of neuropathy, I think of it as being a diabetic result. You were sharing with me that no, that's now the third
Most common cause. It's a common cause. The number one cause is chemotherapy. I mean, you beat cancer and then you get a kick in the head because now you've got to deal with neuropathy because of the side effect. In fact, the cancer centers of America are the ones that developed one of the pieces of equipment we send home called a rebuilder, because the rebuilder actually retrains the nerves to function again so you can get your balance back.
Okay, you said a key word, and then we'll touch on the second cause of
Sure.
neuropathy. But so you have this in-house treatment with the K laser, but then because they're coming to you twice a week, the other 5 days you want them to still have help, so you send home a kit, if you will.
If it's severe enough, you know.
Okay.
Again, we try to get the finances in order for people, because I don't send it home unless they really need it. So if it's more than 50% loss, we probably need to send some home. If they're less than 50% sensory loss, I can handle everything just with in-office treatment only, which saves them money and time at home as well.
Okay, I'm going to go with the second cause, and then we'll talk about some other things
That's
that
right.
you're doing and how the program
Sure.
works. The second cause is surgeries. And the
Yeah.
reason I want to ask you about that is if you are somebody listening to you today and maybe you had a surgery, a knee replacement surgery or something a year ago, can you still benefit from the K laser?
Absolutely, absolutely. First off, what happens is when you have surgery, I mean, it's necessary a lot of times, but it can affect the nerves. You have to cut through nerves to get down to the joint, but hopefully small minor nerves, but it still will affect the joints. And sometimes the blood flow gets compromised depending on the type of surgery you're doing and stuff. So surgery is the number 2 cause, most common cause of neuropathy, both in the hands and the feet. Some people get it just in the hands after a neck surgery or something like that, or shoulder replacement. So what we do is we try to work with the blood flow. The laser increases the blood flow, but it also super heals tissue. And that's just part of it. We have a whole nutrition program that we do keep concise to increase blood flow, increase nitrous oxide, because one of the causes is decreased oxygen, but especially nitrous oxide. If your nitrous oxide levels are down in your extremities, you start to develop numbness and pain and tingling, burning, all those symptoms of neuropathy.
You were telling me off camera about some shoulder pain that you had. If you're somebody who maybe you're considering getting rotator cuff surgery or something like that, can just the problem in a shoulder, a muscle issue or some kind of pinched nerve issue, can that eventually lead to neuropathy?
Well,
in your
it can.
hand?
It can. One of the things that's unique about our treatment is I'll take a little pocket laser here, and I keep that in my pocket. I whip it out, and I work on the whole muscle chain. So if you have a wrist neuropathy or problem or a shoulder problem by itself, I'll go through and test all the muscles in the shoulder, and if it's weak, I can take the laser, I can put it on your neck, and reset in 3 seconds and make that muscle strong. So I don't necessarily have to have 12 weeks of physical therapy to exercise it. I can reboot it just like you reboot your cell phone, make the muscle strong and move on. Nothing against physical therapy, it helps a lot. But as far as a weakness, I can reset that just like resetting your cell phone, make it strong instantly, stabilizing the joint, which is what we do with neuropathy. I take the whole leg chain, hip muscles, thighs, knee, and foot muscles, and reset those muscles to make it strong so you're stable. Because one thing we don't want to do is have you fall, because then you get fractures and other problems, and if you break a hip, you may be bedridden the rest of your life, and we don't want that.
We don't want that. So this is a 90-day program, right, typically?
Basically, yeah, it's 20 visits over 90 days. If you're not there, we extend it 30 more days, and I don't charge extra for that. If you're not where I want you to be, we're going to kick it 4 more weeks out like that.
Okay.
But the cool thing is we have a 98% success rate. 98% of people get a lot better or completely resolved.
So when they're coming in, the 2 times a week that they're coming in, for sure.
Initially.
Yeah, because then you'll drop it down to 1 day a week once you begin to see some success.
When they tell me, Doc, I'm doing so much better, can I go down once a week?
Sure, well, that's a good thing for people.
Yeah, that's a great thing. That's when I do it, when they're satisfied too.
Okay.
We want you happy with our care.
Okay,
and
so
we've
they
been over
come
backwards
in,
to do that.
So they come in and they're going to get the K laser, but then do you do other things while they're there in the office?
Yeah, we do chiropractic care depending on what surgeries they've had. We work gently on, at least if it's foot neuropathy, the pelvis and lumbar area. If the lumbar has been fused, we work just with the pelvis, and we adjust the feet. We move the foot bones around, put them back in position so they got stability, and then we take this laser and I reset all the muscles down the leg chain, and I check it each time. Like the big toe is the 5th lumbar nerve. It's weak, we go up and we reset the 5th lumbar nerve right here. Go back, the toe is strong. Now they got good stability, good function of the 5th lumbar nerve again.
Okay.
It's a lot of fun. It's pretty cool. People are like, oh my God, how did you get that so strong so fast?
And especially with the foot neuropathy, this time of year, does it play into it even more? Because as you begin to wear more of a closed-toe shoe when the weather's colder,
Exactly.
Is that a concern for people?
Well, I even have hunters that go out hunting and they had to stop and wait 2 hours because they couldn't feel their feet and they kept falling until they get some feeling back. And that's the kind of thing you're dealing with neuropathy. If you don't have it, you don't know what it's like. One of the tests we do is with the rebuilder. We have some electric gloves, and so I can take the person, grab their foot or hand. They don't feel anything. Their spouse is there. I grab their hand, and they're like, "Oh, you can't feel that, honey?"
Yeah.
Now they get it.
Now
they understand what their spouse is going through.
So here's how you can get in touch with him. It's Chattanooga Wellness, 2 locations here in Chattanooga, also in Cleveland.
And only $49 to come in and get the full treatment and a follow-up visit with us.
Okay.
To see if we can help you or not.
And
we'll tell
the
you.
website for you to go to is laserawaypain.com.
Yes, ma'am.
Always good to see you.
Thank you for having me.